A successful pilot starts with those honest, above-board conversations. The philosophy that we pay for sickness and fixing sickness, right, is something that we need to change as a whole. We have a long way to go to make people healthy in the first place. We have to think differently. Health systems are not innovation averse. I would remove the concept of prior authorization. It improved performance and outcomes tremendously. We have the thing, no one else can do this, we're the ones disrupting. At the end of the day, right, we spend a lot of time and energy and money on healthcare. We're not seeing the outcomes that we need to see. Founders, first of all, you can do this.
Hi, we are back in New York and I'm super excited about our today's interview. But before that, I'd like to remind you to subscribe to our channel and like this video, obviously. And today we have a special guest. Her name is Komal Bajaj. Hi, Komal.
Hi, Alex. Great to be here. And a big hello to the healthtech community.
Thank you. Let's start traditionally with your short background. Tell us about your career journey and what do you do now?
Yeah, sure, absolutely. So my name is Komal. I'm an OBGYN geneticist, and I'm honored to serve as a chief quality officer within New York City Health and Hospitals, which is the municipal health system for New York City. And so, I really came to thinking about healthcare quality through simulation, which is the use of robots, AR, VR, to unpack complex systems and think about how we solve them. And so I'm always thinking creatively in the liminal spaces of, technology, innovation, and healthcare quality.
What's one experience or story that ignited you about patient safety?
Yeah, absolutely. When you think about patient safety or healthcare quality, there are measures, but it's also a feeling. And so there's probably two paired stories that really ignited a fire that, we really need to think differently about healthcare. The first is when I was starting off as an OBGYN, I was seeing a patient who was telling me about the fact that, she wasn't getting great rest. And here I am thinking, oh, she's pregnant, her physiology has changed. Let's think about positioning, pillows, etc. And so I started explaining all of those things, and she stopped me in my tracks and said, I do not have a bed. And so it really sort of forced me to think about at that, I just started as an OBGYN about how we must think holistically about health. Around the same time, there are some very uncommon emergencies in healthcare, things that happen 1 in 10,000 times, but when they do happen, they're very, very serious. And I realized in some of my sort of travels that when these 1 in 10,000 things happen, events happen, people are generally prepared, try to do the right thing. But just like anything, if you don't do something often, you may not be, as prepared as you might be for something more common. And so at the same time, I realized, healthcare individuals, the individuals themselves are trying to do the right thing. How can we build systems and structures and tools that make it so much easier to do the right thing? And that's really what draws me to healthcare quality.
That's incredible. Obviously, technology should play a big role in that. What would be the biggest misconception startup founders have while thinking about approaching or working with large health systems?
Yeah, I have to address directly. I've been, I've been on both sides of the table where, sort of founders and folks have been pitching, to enter a healthcare system or as an advisor to different companies. And I want to honor the sentiment of this pilot paralysis feeling that is really pervasive, right, in the founder community. And I get it. I think that there's that is an important sentiment to honor. And yet at the same time, I want to acknowledge that health systems are not innovation averse. Right? There is a real thirst and a recognition really by healthcare leaders that we have to be different. We have to do different. And just like you said, technology needs to play a huge part of that. But I think oftentimes, founders need to go back to the basics, really think about, is their product secure? How does it handle data? And really sort of begin to build the trust that is required to get that work done.
so you started talking about pilots. So many stories, unfortunate stories, when like startups are buried under like multi-year pilots and never get out of that phase. Me as a startup founder who should be starting a pilot soon, I'm kind of a little bit scared about it. Tell me, like, what would be number one recommendation for startup founders?
Yeah, so I think, I think that there's so many stories that I could tell, and you're right, some of them go horribly sideways, but there's also amazing examples, right? Both locally and, you're starting to see more and more sort of successful, sustainable interventions, right? Where it's not just one pilot, it's sort of gone through. So I think that it really first starts with, just like you said, I'm a little nervous about this. Having an above board conversation about what does day 1 look like? What does day 7 look like? And really being able to understand each other's pain points. I also think that when founders come in and their solution doesn't have a lot of extensibility, where there isn't an opportunity for the health system to add its own sort of shine or needs to it, that's a challenge. But I can think of many, many pilots where, the health system had a problem, a solution came in and was able to have those conversations, really sort of work together, not just in those first few weeks, but in the months and even year to follow, that really resulted in successful traction and, more importantly, impact to patients. And so I think, to me, right, a successful pilot starts with those honest above board conversations.
Love that. I should do that.
I have no doubt you will.
I know our audience kind of likes like specific examples. Would it be possible for like out of top of your head, like think of some like actual real solutions that did pilots with the health system
Yeah.
and maybe it went incredibly good or maybe a spectacular failure? Like, can you give a few examples?
I can. So I'll start with like one of our early days ones. This was like 8-9 years ago, and it's in the ed tech space. I'm not going to mention any names because
sure.
they're all my favorite. But this company was working on building out solutions to, again, equip in real time physicians and nurses with the skills that they needed to handle complex cases. So in this case, it was using virtual reality technology to have people basically run through, just like you stretch before a race, to basically run through the procedure they were going to be doing, and then sort of do that procedure, right? And so what that required was a real understanding of how those procedures occurred in local environments. And remember, even within a health system, one place might do something a slightly different way than, say, hospital B in the same health system, right? And so it was the ability to quickly work through those customizations and then with real physicians, nurses, et cetera, give those individuals the feedback that they were looking for. And I'll tell you, it improved performance and outcomes tremendously. And so, that is just one of the earlier examples that comes to my mind where it was that sort of thoughtful recognition of, even though we're talking about one organization, even one organization or one patient population has variance within it, and how can we accommodate for that variance? Our very first measures weren't how many users, right? Because that's an easy one. Like, oh, we ran 30 people, 100 people, 2,000 people through something, right? We have 3,000 people on our app now, or we have 5,000 people using the solution. It was actually customizing where people are looking, how people are moving, right? And providing that feedback. And I thought that was just a really cool, early way of piloting successfully. And now that technology is used across the globe in like more than 100 countries.
When a startup founder approaches you, and not specifically you, for example, but any health system, what do you think for the health system would be like red flags that this guy is not even close to being ready to do a pilot with us?
Yeah, I think there's probably a few things, right? If there's no one who has actually been involved with healthcare, right, or who has sort of helped solve whatever problem they're trying to solve, I think that is a potential red flag. I think another thing that comes up actually a lot, and founders, please hear me, right? Again, I sort of alluded to it earlier. It's not just about how many people did we move through. It's about being able to understand your impact and your measures, right? If your goal is diabetes control, that's an amazing outcome, right? There's probably process measures in between that. How many people are checking their sugars? How many people are taking their medicines that you can sort of begin to tackle and get at, right? And so a big flag is when people can't really speak to some of those shorter and longer term outcomes. And it's okay if you don't have 6 months, years of data, right? It's just the thoughtfulness of being able to say, these are the things that that we can measure and track. How does this align with what you, the health system, are interested in tracking?
A startup founder should try to find an advocate for their solution, among clinicians and healthcare providers first before going to the
I mean,
management?
listen, human beings are human beings, and how you relate to someone, right? If someone really understands what your product does and can speak on your behalf, of course, it makes all the difference. I think something that's an interesting point here, Alex, is that the governance around technology is shifting. You and I have spoken previously a little bit about, the fact that there are now chief AI officers, chief AI and data office, chief digital officers. There's sort of more roles than the traditional sort of CIO. And as a result, who are your apex stakeholders is shifting. And honestly, there's a little bit of friction, right? There can be some friction. And so I think understanding who those players are and building those relationships, absolutely it matters, right? You're not going to be inauthentic about it, right? You're going to talk about the pros and cons of your solution. You're going to, say what it is, and people can really advocate for you.
At our healthtech event, you did an amazing keynote, so many great insights. But I wanted to talk about this specific thing. You mentioned that startup founders should use and leverage some public resources like healthcare effectiveness data and information set and community health needs assessments. Can you tell our audience what that is?
You just laid down a whole bunch of words, Alex.
Pretty much.
So I'll start with first just by saying that so many founders, startup leaders go into conversations sort of doing their best to guess what are the key priorities for a particular health entity. And what I'm here to tell you, and the words that you just mentioned, is that a lot of that information is actually readily available. And so why does this matter? Don't guess, right? If you can see publicly what's available, you by definition know what someone's pain points are. So there's many, many that are out there, but there are a few that I will highlight, including the ones that you mentioned. The first is the CMS star rating, right? Every healthcare delivery entity has a 1 to 5 rating. And really, these ratings were developed by CMS to make information more transparent to the public, right? And so there's about 60 measures. They're primarily inpatient measures that are sort of part of this rating, and it is adapted every year. Every year it's shifted. So if a health system has a 2-star, if a facility has a 2-star rating, or a clinic, if there's a certain rating, right, that by definition people are going to be working on those things. So align your conversation to, one, what you're seeing, and also make sure that when you're talking about measures, you're using the same numerators and denominators that CMS and others are using. Another publicly available rating is Leapfrog. So Leapfrog is a non-for-profit, again, sort of with a similar vibe of trying to get, more information to the public. And so this includes inpatient measures, but also some outpatient measures. And again, provides an A to F rating. And so it's all available. You can look at each measure and where people are at. And so use it. You mentioned HEDIS, and so HEDIS, because we love acronyms, is Health Effectiveness Data Set, something. Information data set, right? It's a word salad. And so this is a set of measures that really comes from payers, right? It's a set of measures that payers use and health plans to evaluate performance. And so there's a lot more outpatient measures in HEDIS. Now, not every health system participates in HEDIS, but a vast majority do. Like 200 plus million lives are covered or are included in HEDIS. And so again, if your product helps close gaps, right, you're not just improving care, right? These HEDIS measures are used for reimbursement. You meet certain targets. There's additional monies that are available. And so again, you're tying your product and your impact to those highest level goals. And the last but not least you mentioned is the Community Health Needs Assessment, or CHNA. Every accredited organization is required to complete this every 3 years. So now we talked about things that are sort of reported to CMS. We've got the payer measures. This is really the voice of the patient and community. And so every health organization will go out and talk to people and publicly report what was said about key priorities and how they're addressing community needs. Basically, what they're doing is providing you a playbook of what their existing partnerships are and who they're already working with. So rather than you spending your social capital with that one person who's willing to hear you, right, asking, hey, what are you doing? Who are you talking to? Whatever, use that social capital for something else.
I have to ask, what are your personal expectations of AI? Because everybody seems to be betting on AI in healthcare and healthcare delivery. Let's say in 5 years, what are your expectations? Is it gonna change a lot, a little? Will it be adopted?
Yeah. So my basic tagline is that I'm very optimistic. I'm particularly optimistic in the potential, and we've already started to see this, of AI in eliminating some of those functions that people don't want to do. I'm thinking about different paperwork, right? I'm thinking about a lot of back-end functions that just really are not something that anyone who went into healthcare really wants to do. But yet need to do. So I think that's sort of one key bucket. It's sort of giving back people the time, the energy, the mental space to do the amazing healing and work that they were wanting to do. I also think that, listen, like I'm wearing a wearable, so are you, right? I also look at the potential of AI-based technologies to make healthcare better and safer by virtue of the fact that we can make care not episodic and rather something that like walks with you side by side with you. Now, is that going to be in 5 years? Maybe. I hope it is, right? Especially there's a lot of pushes to make that happen because at the end of the day, right, we spend a lot of time and energy and money on healthcare. We're not seeing the outcomes that we need to see. So I think there's a few buckets. One is those back-end functions and giving people the time and energy back to actually do the healing they were meant to do. I think there's a whole set of technologies that will then unlock information and insights that we never could target before, right? I mean, people spend less than 1% of their lives, hopefully, right, engaging with healthcare delivery. So what about that other 99%? And then I think also which will take a little bit more time, this idea of sort of risk prediction, predictive analytics to then really supersede what is already happening with sort of healthcare delivery. I'm thinking about more advanced things like automated surgery, right? That probably won't be in 5 years, but I think that sort of stepwise approach will get us to a point where we can think more proactively about health and care rather than the current muck that we're in now. Are you optimistic?
I'm very optimistic.
I knew you would be.
Especially on the prevention side.
Yeah, me too. Me too. I think it's interesting, like in talking to a variety of healthcare executives across lots of different places and spaces, you find pockets of healthy optimism. And then there are just some that are like, very terrified because they are worried about cost or they're worried about, these solutions not working up to a standard. And I'm like, well, we have a long way to go to make people healthy in the first place. We have to think differently.
100%. You've been in healthcare most of your life.
Yeah.
And closer working with health tech and companies and startups. What is the most overbuzzed word you've heard in health tech space over the past few years? Which one you would like to kind of get rid of?
Yeah, wow. It is interesting how kind of something becomes a huge buzzword, and then there's an ebb and flow. And actually, that would be a really interesting podcast, or just sort of how things have evolved. But I will say I hear almost too much disrupt. And I will say, listen, I just said 2 seconds ago that we need to think differently and we need to change healthcare. But there's something about the way, people will just use that word over and over and over and over and over. And it's like, well, what does that exactly mean, right? And when I think about, sort of tech that is truly integrated into a healthcare system, what it's doing, it's acknowledging that the system is complex. If you do something over here, it might impact something over here, and being mindful of that. And also, we need to be a lot better at sunsetting things, right? And so, yes, there's an element of you're changing what, by definition, what is happening. But I think that the word disruption ends up being is it really disrupting? Is it disrupting-ish? Is it sort of disrupting? And so I think that if we could sort of just stay away from that word and instead describe what is actually going to happen, I think we would all be a lot better off.
Let me just remove disruption from my pitch deck.
You're like, hold on, wait a minute.
Yeah, hold on.
Find all.
All 200. I'm kidding.
What word comes to your mind?
I think what you said at the beginning, that at each, basically every 2 years, it's a different word. And we had big data,
Yep.
Then we had, machine learning, now it's AI.
Yeah.
And people just start using it every time, even when it's needed. So it was a tricky question, but
Yeah, I think I also just think about the flavor of pitches, right? Everyone wants to come in and say, we have the thing, no one else can do this, we're the ones disrupting. And I'm like, it's probably true that you have a good solution. It is unlikely true that no one else is doing this, right? And so let's have a real conversation about why it is your solution and our delivery system that should meet, and be matched.
But I want to kind of get your take on this kind of controversial idea that I have for a long time.
Okay.
A lot of startup founders, when they pitch their products, one of the probably biggest problem they solve, at least they say they solve, is saving cost.
Correct.
From what I hear and I see in the industry, I feel like all those margins that the startup might save, they become the revenue of the startup. So even, yes, maybe it saves some money, but the US healthcare system overall, and you can see on the budget and how it grows every year, there is no much cost saving. Would you agree
that's
with that?
interesting. Well, I think that I agree with you, right? When a solution is adopted, by definition, that company has to make some money.
Right.
But I will say that I maybe disagree with you a little bit in that, right? So many of the things that we'll do. The simplest example of prior auth, right? Or documentation, right? People spend a lot of time and energy, right, doing those sorts of things, when in reality, there are very simple not simple, but there are relatively simple AI-based ways of doing that, right? And so I think that in the short term, what you're saying might be true, right? But as we move from pilot, right, with a well thought out pilot, then having agreements on if a pilot is completed, what gets moved and what are we sunsetting, I think that cost conversation shifts, right? And the health system will see savings from the work that's being done, and we see examples of that, right? But I think that, again, we're in this period right now where, when we're talking about things that are sustainable and well implemented, we're talking on the order of a year, right? We're not talking about 3 years, 5 years. And certainly as sort of the federal sort of landscape continues to shift, and what is prioritized and what is paid for changes, I'm imagining, that calculation will continue to shift as well.
I'd love to be wrong on my hypothesis, but I would like to see some data proving me wrong in a few years,
Yeah.
for sure.
I would too. You know what I mean? I think, to your point, Can anyone say convincingly that you're not right? I mean, no, because to your point, we're just not there yet.
Imagine you have an absolute authority to remove some bureaucratic or regulatory hurdle, and you have this authority for one day. What would be one thing that you
Oh
would
my
remove?
gosh, so many
Just
things.
one thing. Just one
And
thing.
it's scary, right? So I will say there's one concrete thing, but it sort of, I think, is emblematic of something that's a sort of a theoretical sort of philosophy change. I would remove the concept of prior authorization. I mean, we're already starting to see some pushback. There's some great work in some states, but I think that the amount of energy that is spent on prior auth is it's really burdensome. It's not great for patients. It's not great for healthcare providers, virtual or not virtual. And so I think that that would be just sort of slice it and never bring it back. And so I would say in that one day, I would make it such that it could never come back, right? But I think spiritually, right, the philosophy that we pay for sickness and fixing sickness, right, is something that we need to change as a whole, right? And prior auth is obviously just sort of micro emblematic of that sort of concept. So I'd take my one day and write it into legislation forever.
I love that.
If only.
Well, maybe some gods will hear you.
The prior auth gods.
Yeah, prior auth gods. All right. Finally, at the very end, I ask my guests to give one last piece of advice for startup founders in health tech.
Founders, first of all, you can do this, right? You are a founder because you had a great idea and you have a great burn, right? There's something that you need to solve. And so I will say to you, stick with it. And I would say that learn, just if nothing else, right? Some of those resources that I shared earlier about the pain points for health systems, get to know the people that you want to work with, because you're building something that matters and that can change lives. And so help us help you close the implementation gap, right? So let's do that together.
Can I ask you a small clarification?
Yeah, sure.
In the startup world, maybe aside from healthcare, people say that you need to break things and move fast. And actually, what is even more important, to fail fast. And you said something important, like stick to your vision, stick to your goals. How long do you stick to that? Like how long do you know that it's working out or it's not working out?
Yeah, I mean, I think you brought up something that I think is really, really important. Like, stick to it doesn't mean that you at the cost of not learning, right? Stick to it, just like you said, right? So I think this idea of failing fast is really important, even in pilot phases, right? When I said, I want to know what day 1, day 7 measures look like, it's for that reason, because there is no chance that any solution can just be blunk, plug and play, nothing, no attention required, right? And so what I mean by stick with it, I mean, 1, the life cycle or the sort of sales cycle within healthcare is longer than most, right? So I mean, at that point, stick to it. And I think that you said it, right? Like when you mean break something, it means you're going to try something in a calculated way, in a safe way, iterate and keep moving, right? And those agreements need to be made with your health delivery partners from the beginning, right? We got to think differently, and it's going to take all of us together.
Let's do this. Thank you so much, Komal.
Let's do this. Bye, everyone.